Assalamu alaikum. Today we'll talk about the fourth and the last type of pharmacoeconomic evaluations, cost-benefit analysis. So cost-benefit analysis is a full pharmacoeconomic evaluation that satisfies both conditions. First, cost-benefit analysis identifies, measures, and compare both cost and consequences. In this type we will call benefits. And the second condition we should have at least two alternatives to compare. Now the special thing about cost benefit analysis is that the benefits or the consequences are expressed in monetary terms. فالبوينت هلا الكوست already هي بطبيعتها monetary. هلا البنفيت اما انه هي اصلا monetary او يعني الفائدة اللي احنا بنحققها من الانترفنشن monetary او انه احنا we can convert to monetary values. So in cost benefits analysis the outcomes are expressed in monetary terms. An example, a program implemented by an insurance company, for example, to educate patients, asthmatic patients, about the proper use of inhalers, for example. For this program, it is of course an intervention. For this program, of course, there is a cost and there is a benefit. Now the cost is monetary by its nature, and in this case also benefits are monetary, are money saved by the insurance company. بسبب إنه البيشنت اللي صاروا well educated about the proper use of inhalers أكيد رح تقل زيارتهم على الإمرجنسي ديبارتمنت وعلى الهوسبيتال، وبالتالي رح يصير في عنا saving للإنشورنس كومباني اللي بتغطيهم. فمن خلال هذا البروجرام زي ما حكينا الكوست هي monetary والبنفيتس كانت بطبيعتها monetary اللي هي money saving for the or by the insurance company. Now in some cases the benefits should be identified and then converted into its monetary value, of course in the year in which they occur، لأنه أكيد الماني دائما مرتبط مع التايم. يعني حتى لو كان البنفيت بطبيعتها clinical خلينا نقول، يعني مش هي أصلا monetary in nature، إحنا المفروض حتى إنه نعمل cost benefit analysis نحول البنفيت للمونيتري value. طبعا أكيد في methods رح نحكي عنها لقدام. Now after having both costs and benefits in monetary values, then we can simply calculate the ratio of benefit to cost or cost to benefits. When we say cost, it's the cost of implementing the intervention or the program, and the benefits are those benefits arose as a result of a program or intervention. An example, a new heart failure monitoring service implementing by an insurance company. Now the cost per patient is $100 and the benefit arose from this intervention or program is estimated to be 1,000 per patient, and this 1,000 in hospital care per patient. So this heart failure monitoring service decrease the hospital care or hospital inpatient admissions by 1,000 per patient. Now the benefit to cost ratio is simply dividing the benefit by the cost. The benefit 1,000 divided by 100, so we have 10 to 1. The interpretation of this benefit to cost ratio is that the service produces $10 of benefits for every $1 that is spent or invested. يعني لكل دولار spent or invested أعطانا $10 as a benefit. فهذا هو مبدأ الانفستمنت، إنك أنت تدفع مبلغ حتى يرجع لك إيش return أعلى in the future. Now another example of cost benefit analysis, we have drug A and drug B, and we have both costs and benefits. Now the costs are, of course, by default in monetary values. Now we are calculating the total cost. We have acquisition cost, سعر الشراء. We have administration cost, monitoring cost, and adverse events related to this medication. Let us assume at the time of administration. And now the total cost for drug A $400 and the total cost for drug B is 350. So the drug A is more expensive than drug B. In this example, the benefits are not monetary in nature or by default. We have days at work allowed by the drug, and we have extra months of life, of course, because of the drugs, let us say. Now, days at work for drug A are valued of about $1,000 and the same for drug B. Extra months of survival for drug A are valued of about 2,000 for drug A and 3,000 for drug B. So we can assume that drug B produce more months of life. Now the total benefits for drug A 3,000 and the total benefit from drug B 4,000 after being converted to monetary values. Now to calculate benefit to cost ratio, simply we divide benefit by cost. For drug A, divide 3,000 by 400, 7.5 dollars in return for each $1 spent. For drug B, dividing 4,000 by 350, and we have 11.4 dollar returned per each $1 spent. So accordingly, as long as the cost or the benefit is higher than the cost, we can say that the intervention is cost beneficial. So in this example, both drug A and drug B are cost beneficial simply because benefits are higher than cost for both medications. Also, we can say that drug B is more cost beneficial than drug A because drug B has higher benefit to cost ratio. For drug B, the benefit is 11.4 for each $1 spent, which is higher than the ratio in here. For drug A, $7.5 for each $1 spent. زي ما حكينا بهذا الاكزامبل كوست. طبعا احنا الكوست يعني ما بناخد بس سعر الشراء، بناخد الادمنستريشن والمونيتورنج، يعني حتى ان احنا كل الكوست اللي انكر لحتى ان نحصل الميديكيشن. لدرج A كان 400 ودرج B 350 وحكينا درج A more expensive كان. هلا البنفيتس السبيشال ثينج هون انه البنفيتس ما كانت هي بطبيعتها مونيتري. البنفيت باختصار كانت اللي هي عدد الأيام at work as a benefit من هذا الميديكيشن، والسرفايفل اللي هي extra months of life. فزي ما انتم شايفين تقريبا عدد الأيام at works أو الفاليو المونيتري فاليو للdays at work كان the same for drug A and drug B، لكن السرفايفل لدرج B كان أعلى، أعطانا more benefit. يعني لو حكينا for example إنه ال 1 month of survival يعني value يعني just for example of خلينا نقول $100، معناته درج A أعطانا 20 يوم، تمام، 20 days and 20 months، and درج B أعطانا 30 months. وبالتالي كان لما ضربنا 30 by 100 أعطانا إيش 3000. بعدين لما جمعناها مع ال days at work أعطانا إنه درج B أعطانا إيش more benefit than درج A. ولما قسمنا الريشيو البنفيت للكوست كانت البنفيت to cost ratio لدرج B أعلى، بمعنى إنه more cost beneficial. نقدر نحكي إنه drug B more cost beneficial. الشغلة الثانية بنقدر نحكي إنه both drug A and drug B are cost beneficial لأنه كلاهما البنفيت كانت أعلى من الكوست. طالما إنه البنفيت أعلى من الكوست بنقدر نحكي عن هذا الانترفنشن إنه cost beneficial. Now, the main advantage of cost-benefit analysis is that we can compare different outcomes because outcomes are valued or converted into monetary values. This is unlike the cost-effectiveness analysis in which we cannot compare different outcomes. The main disadvantage in cost-benefit analysis is that placing economic values on medical or clinical outcomes is not an easy task and sometimes is not ethical. And also there's no universal, no standard methods to convert medical outcomes into monetary values. مثل ما حكينا المين advantage للcost benefit analysis إنه إيش ما كان الأوتكم إحنا we can convert to monetary values. فبنقدر نقارن intervention للديابيتس مع intervention للأزمة، ما في أي مشكلة طالما إنه البنفيت أو الكونسيكونسز راح نحولها للمونetary values. الكوست هو كوست بطبيعته monetary والأوتكم نحوله للمونetary value. فهذا الشيء طبعا مش زي ما حكينا cost effectiveness analysis، لكن كنا إنه الأوتكم لازم يكون exactly the same the same type. هلا disadvantage إنه كتير صعب لما يكون الأوتكم طبيعته medical أو clinical إنه إحنا نحوله للمونيتري، وزي ما قلنا أحيانا بكون يعني مش منطقي إنك تحوله زي الإكزامبل اللي قبله months of survival نحولها قد إيه بيسوى الشهر، لكن still في value للcost benefit analysis. هنشوف هلا in the following example that we want to choose between some programs to implement in a certain organization. We'll try to take the decision based on cost effectiveness analysis and then based on cost benefit analysis. بس لحتى نشوف إيش طبيعة المعلومات اللي إحنا بنحصلها من cost benefit analysis كيف ممكن إنها تساعدنا in some situations. So in this example we have five totally different programs. We have one program for AIDS prevention and awareness, another for vaccination in children, another for smoking cessation, another for diabetes adherence, medication adherence, and one for breast cancer screening. As you can see, these are different programs, of course, with different outcomes. Now let us compare these programs based on the cost effectiveness ratio. Now our goal is to choose one of these programs, of course, because we have limited resources and we cannot implement all these programs. So we want to choose, let us say, we want to choose the most cost effective based on cost effectiveness program, the most effective program. So for AIDS prevention we have and this is the average cost effectiveness ratio, we have 230,000 per case prevented. Now we have different outcomes. This is AIDS case prevented. Now in the vaccination for children we have 104,000 for each case prevented by the vaccination, also different outcome. Now for smoking cessation we have 3,700 per quit smoking. Diabetes adherence $67 for each normoglycemic patient. Breast cancer 500,000 for each life year saved. So now we are talking about totally different outcomes. So can we choose the best program to implement? In fact, it's very difficult to choose and need a lot of work to value the consequences of each like effectiveness measure or of each clinical outcome for these programs. كتير صعب إنه إحنا نختار بناء على ال cost effectiveness ratio لحالها. طب أنا بحكي 230,000 ل AIDS case prevented. طيب مين أهم؟ مثلا هنا 104. طبيعة الإشي بيختلف. الأوتكم هون اللي هو كيس ممكن نقول إنه هذا ال childhood paralysis. فيعني هون بير كويت 3070 بير كويت. طبعا كل outcome من هدول إله consequences. فإحنا صعب جدا إنه إحنا نرتبهم. very difficult to order these cost effectiveness ratios simply because the outcomes are different in nature. So we cannot order these ratios, and that's again very difficult to choose only based on cost effectiveness ratios. Now talking about benefit to cost ratios for AIDS prevention awareness program, we have 8.4 dollar per one for each $1 spent. For vaccination in childhood, 0.3 per $1 spent. For smoke cessation, $6.7 in return for each $1 spent. In diabetes, $15 benefit for $15.1 benefit for each $1 spent. And breast cancer, we have $2.4 in return for each $1 spent. Now, looking at benefit to cost ratios, we can simply order these ratios descendingly. So we can say now the most cost beneficial program would be the diabetes medication adherence program, because it has the highest benefit to cost ratio, almost $15 per each $1 spent. Then we can choose the AIDS prevention and awareness program, 8.4 for each $1 spent, and so on. So we can simply order the benefit to cost ratios and choose the most cost beneficial program. So this way is using cost benefit analysis is very helpful to take the decision in this situation, comparing different programs. Also, according to the benefit to cost ratio, we can easily say which program or which programs are cost beneficial. We can say all these programs are cost beneficial except the vaccination program for children, because the benefit is lower than the cost, $0.3 for each $1 spent. So we are losing in here. So we can say that vaccination program for children, this specific vaccination program is not cost beneficial. اللي احنا عم نحكي انه احنا حاولنا ناخد decision بهذا السيتويشن، يعني بناء على cost effectiveness ratio كان يعني very difficult، لأن احنا صعب نقيم مين اللي أهم، اللي هي قديش أهمية إن نمنع AIDS كيس مقارنة بالباراليسيس، مقارنة إنه نعمل cessation أو quit للسموكينج، أو إنه نعمل patient normal glycemic. طبعا كل واحدة إلها cost per unit، فكتير صعب إنه إحنا نختار بيناتهم. ما إحنا ما بنقدر طالما إنه اليونتس بتختلف، إحنا ما بنقدر نرتبهم ونختار. فبينما بناء على cost benefit to cost ratio إحنا سمبلي رتبناهم، حكينا إنه أكتر واحد كان cost beneficial هو اللي أعطانا أكتر per unit per dollar spent، اللي هو كان diabetes medication adherence program. وبعديه بيجي عنا ال AIDS prevention، بعدين ال smoking cessation، بعدين ال breast cancer screening program. يعني هذا لو بنرتبهم حسب الأولوية. آخر إشي اللي ما رح نعمله اللي هو vaccination، لأنه أصلا إحنا بنخسر فيه، لكل دولار spent إحنا بنرجع 0.3، وبالتالي إحنا بنطلع خسرانين. فهاي الأهمية الكوست أو ال cost benefit analysis is very helpful in taking decision, helpful for policy makers, for those in charge for taking decisions about choosing between different interventions for different diseases and so on. So as we said, benefit to cost ratios can be ranked, and this is an advantage. Different programs and also similar programs can be compared, and the decision makers can determine which program's cost will exceed the benefits ahead of time. So in other words, decision makers can determine which programs are not cost beneficial. When we say cost exceed benefits, so we are saying not cost beneficial, and vice versa. Decision makers can determine which programs are cost beneficial. In other words, the benefits exceed the cost. If the goal is to maximize the investment, and usually this is our goal, investment is having a return for money in the future for money spent now. The program with the highest benefit to cost ratio would be chosen, of course, because in this way we are maximizing the investment. Although clinical pharmacy programs have shown improvement in clinical outcomes such as glycemic control, bone density, still we need to demonstrate if these programs are cost beneficial. In other words, decision makers want to know the following. Do the benefits of a program or intervention outweigh the cost? In other words, are these programs are cost beneficial? And which program will provide the greatest benefits? So of course we want to maximize the investment, and because we know that we have limited resources, so we want to have the program or the intervention that will give us the maximum return for the money spent. Cost benefit analysis is a tool that can be used to address these questions. فاحنا بالكلينيكال فارماسي ستيل في كتير انترفنشنز نعملها وفي إلها كلينيكال امباكت وفي يعني ادفانتجز لإلها، لكن ستيل إلها كوست وإحنا بحاجة إنه نبين إذا كان هي cost beneficial ولا لأ. in this case sometimes we may need to convert the outcomes into monetary values to compare with cost، يعني using cost benefit analysis. فهو cost benefit analysis in fact very helpful لل decision makers لما بدهم يعملوا allocation for resources.